Have you ever wondered about eye movement desensitization and reprocessing therapy? This video is for you. We're going to be covering what is eye movement processing, what it is, how it works, the science behind it, the controversial science behind it, how to find EMDMR, resources, free EMDMR, free trials of EMDR, how does it work, we're going to be going through a bunch of different resources if you want to learn more about EMDR. So that's what we're going to be getting into this video. If you are new to online mental health reviews, please do subscribe and leave a comment below with any questions you might have about EMDR or a suggestion on which service, app, course we should buy, try, and review. Okay, let's dive in. EMDR, eye movement desensitization and reprocessing. There were a few things that I really liked in this WebMD article. First of all, and we'll talk about this later, EMDR is most widely known and probably best for PTSD or PSD, actually, in the newest version of this language. PTSD is actually now called PSD, but this article was written a few years ago. And the point remains the same, however, that EMDR is best for PTSD. That's one thing I want to get across right away. We do have a few different people who really recommend EMDR, which are highly valid sources. The American Psychiatric Association has noted that EMDR is effective for treating symptoms of acute and chronic PTSD. So that is where this is best for. According to the APA, EMDR may be particularly useful for people who have trouble talking about the traumatic events they experienced. All right. So if you're wondering about EMDR, there might be better therapies out there if you can talk about your trauma. If you are dealing with something that's not trauma related, for example, anxiety that's not trauma related, or depression that's not trauma related. Okay, so how does EMDR therapy work? Well, I found this description on emdr.com. What is EMDR? And how it works is that EMDR therapy is an 8 phase treatment. We're not going to be getting into all the phases, but the eye movements are used in the first part of the session. And what you do is you target a memory. So, trauma, there's something unpleasant, highly negative, whether it's combat, assault, an accident, grief, some sort of trauma. So, what happens when this eye movement rapidly goes back and forth? According to a Harvard researcher, is that internal associations arise and the clients begin to process the memory and disturbing feelings. In successful EMDR therapy, the meaning of painful events is transformed on an emotional level. For instance, a rape victim shifts from feeling horror and self disgust to holding the firm belief that I survived it and I'm strong. So, this is very interesting that EMDR is not from clinician interpretation, it's not from talk therapy, it's really from the client's own accelerated intellectual and emotional processing. So, how this works in this other article by My Cleveland Clinic is that your brain stores trauma memories in a way that doesn't allow for healthy healing. Trauma is like a wound that your brain hasn't been allowed to heal. Because it didn't have the chance to heal, your brain didn't receive the message that the danger is over. When combined with eye movements and guided instructions, accessing those memories helps you reprocess what you remember from the negative event. This reprocessing helps repair the mental injury from that memory. Remembering what happened to you will no longer feel like reliving it, and the related feelings will be much more manageable. Now, in my opinion, keep in mind this is an opinion. I don't know a ton about EMDR, but as a practicing coach and counselor for many years, someone who's worked in the mental eating disorder field for many years, in inpatient, in hospitals, you name it. I personally think that the rapid eye movement is a lot like tapping. It's a lot like some grounding exercises that people do in talk therapy when they're talking about trauma. So, for example, when trauma comes up, it can be overwhelming, and there needs to be some tools. Oftentimes, I'll be telling someone like to maybe rub their fingers together or some way. Usually the client will have some sort of their own way. One woman was to rub the thumb of her finger softly with her other finger, just to stay grounded and to feel to feel the present moment, right? To feel her fingers rubbing together in the present moment while she talked about trauma, while she talked about a painful emotion. And instead of getting drawn into the painful memory and being overwhelmed by it, it was like she was able to stay one foot in the present moment while the other foot was in the past. And I think that's the key with EMDMR is that when you move your eyes side to side, there's something rhythmic about it. There's something soothing. There's something that keeps you present. You know, you have to keep your eyes moving back and forth. You can't just fixate or freeze up. So I think like that staying present, helping you reprocess the memory through your eye movements is the key. I think you can do this in talk therapy. I think that you don't necessarily have to move your eyes side to side. Um, Maybe there is something to do with the rapid eye movement, like sleep, you know, when you're sleeping, how your eyes go back and forth. There might be a small effect to that. But speaking of small effects, we can also start exploring the science of EMDMR. Okay, so I was able to find some great science studies about EMDMR, and I'll go through these. So, first of all, meta-analysis is better than other types of science. This particular meta-analysis was based on 8 independent samples and 75 effect sizes. And this results just simply indicate that trauma-focused cognitive behavioral therapy and eye movement desensitization reprocessing had a large and significant overall effect on reducing trauma symptoms and externalizing behavior problems. So we have one large meta-analysis saying EMDMR and CBT work in reducing trauma symptoms. However, there is a different study, a different meta-analysis, which has 76 trials, and they look at 4 studies in particular out of 27 because most of the studies have publication bias, and I'll actually show you one such study coming up that had a big publication bias. So, for example, this meta analysis notes that EMDMR was more effective than other therapies, but not in studies with low risk of bias. So, there's a lot of bias in the EMDMR literature. Now, even this meta analysis, however, does note that EMDMR may be effective in the treatment of PTSD in the short term, but the quality of studies is too low to draw definite conclusions. Again, so there's no problem with EMDMR, but there isn't quite enough evidence to advise it for the use in other mental health problems. So this really comes back to what I said initially. If you're dealing with trauma, PTSD, PSD, EMDMR, it can be very good, especially if you don't want to talk about it, if you have troubles opening up. That's who EMDR is best for. That's where the evidence is. That's where the sweet spot is. Trauma, that's hard to talk about. Now, this is an example of an article that has a lot of bias. So if you go to emdrtherapy.com, they'll list this study as one of the main studies that supports EMDR research. But if you look at this, a real world service evaluation was conducted from a self selecting group of EMDR therapists. Okay. So, author designated questionnaires were used to gather information on the efficacy of EMDR delivered online as well as client therapists. So, 33 therapists provided efficacy data on 93 total patients. Conclusions: EMDR delivered via the internet can be an effective treatment for adults experiencing mental health issues. So, notice how this conclusion is much broader than the other conclusion can, that accounted for bias. You can tell that this is a biased group. This is a biased study. Um, Again, while this study says it's good for all mental health issues, the other study is really saying it's just good for PTSD. There's no evidence to really suggest for other studies. That's where I'm at as well. I did find this excellent Scientific American article. Um, and I'm just going to scroll down because, again, all these resources will be down below as well. Um, Here's the conclusion of this article. So, now to the bottom line. EMDR ameliorates symptoms of traumatic anxiety better than doing nothing and probably better than talking to a supportive listener. Yet, not a shred of good evidence exists that EMDR is superior to exposure based treatments that behavior and cognitive behavior therapists have been administering routinely for decades. Paraphrasing, what is effective in EMDR is not new, and what is new is not effective. So, if we take this in context of this video so far, we have the eye movement is good, it's better than nothing, but it's not necessarily better than cognitive behavioral therapy. Okay, so now that you have sort of a more balanced perspective on EMDR, what it is, how it works, and who it's best for, let's now switch over to how you can actually find an EMDR therapist, some resources, etc. So, one great resource is ZocDoc. ZocDoc is just the Google for a therapist. So, let's just type in, there we go, EMDR therapy. Here's where I live. You can find a time, and then you could also select your insurance. They have a ton of different insurance options. So this is just so great of a service. You can find dentists, doctors, OBGYNs, just so many different ways, and it's all through insurance as well. So I'm just go to the big insurance provider to show you how this works. Um, and let's just see who's near me. Just show the search results. There we go. So you can see that in my area, I'm around here. Looks like there aren't people nearby. This is about a half hour probably. But if I wanted to, and they also do video visits as well, but you can see that I could easily book an appointment nearby within my insurance network. I can see ratings. I can see who this person is. It's just such a great service, especially if you're looking for EMDR therapy or other resources, and insurance will cover it. So you definitely want it. This makes your life easy. It really does. So that's just the number one way. ZocDoc link is down below. I will show you this link as well. This one is more for your own exploration. I'll include the link below, but there are a lot of EMDR blogs. There are a lot of different nonprofit associations, especially if you're a therapist and you want to get trained. There are tons of resources online. I'm just going to go through this list real quick. We have the EMDR therapy blog in the UK, another EMDR blog in Utah. So this is an interesting one. EMDR healing blog is written by two patients who've been practicing EMDR both on their own and also with therapists. So that's kind of interesting. They have a ton of different blogs about it, from coaches to clinical psychologists, trauma recovery. So this is an excellent resource if you want to find other free resources on EMDR. Okay, so then finally, there are virtual solutions as well where you can start. Okay, and finally, there are virtual solutions online, EMBMR, which involves a variety of uh, training videos, online tools. You can also talk with a therapist. Tons of different free trials that you can try. One of them, probably the best one on the market, is virtualemdmr.com. So let's just check out that real quick. Okay, so once you join the virtual EMDMR platform, you'll be able to launch the virtual EMDMR program. And this is where you can begin. So there is a self guided session that you can use anytime, anywhere without a therapist. So, again, really good if you're feeling very uncomfortable with talking with trauma. This is sort of the problem that you're going to select you want to deal with, whether it's an anxiety protocol. They have these different protocols that are tailored to address problems commonly treated with EMDR therapy. So while I'm only recommending EMDR for PTSD and trauma, there are grief and loss, addictions, etc. There are also lots of different tools, self assessment tests, a grounding exercise, data. So that concludes this video on EMDR therapy. I hope it helps you. Be sure to subscribe. Again, leave a comment if there's anything about EMDR that you're not sure about. You can also leave a comment with a therapy, symptom, course, app, service that you want us to review, to study, to write about. Just leave a comment below. Be sure to subscribe. Okay, thanks so much.